So Todd, thanks for making the time. I'm excited about chatting with you about some of the recent development and the great win for Cohealo, but I thought we'd start off with if you could just share a little bit about your background, you know, what you do at Cohealo, and some of what you've seen in the healthcare industry. That'd be great.
Sure. Well, I'm Todd Rothenhaus. I'm the CEO of Cohealo. I've been the CEO of Cohealo for about 15, 16 months. Prior to that, I was a senior vice president at Athena Health. I led a couple of different products as general manager there over about a 6-year run. Prior to that, I ran IT for a PE-backed health system. And a long, long time ago, I was a practicing doc. The industry, healthcare industry is kind of in shambles right now. I think there's a lot of unexposed, weaknesses in the system that we're seeing right now as COVID. Like every other industry, it was over leveraged, but I think this is a very unsatisfying result for just about all the players who are in there. I don't think it's what's happening.
In the aftermath of the '08 crisis, right?
Well, yeah, I think the all the other disasters that have happened are sort of like unfortunately, I don't know how to describe it politically correct, but it's sort of like a done, like 9/11 was a recovery. Even the crash, I guess there was so much structurally wrong there. It took a long time to come back. I'm actually fairly convinced that we could bounce back relatively quickly because we're so dynamic as a system. I mean, the unemployment rate going up and skyrocketing is a sign of sort of human liquidity now. And I think a lot of those people will jump right back into the workforce very quickly. So I think the real goal is to really get the economy going again. I'm all for that. I just think the question is not doing it dangerously. And I think that's kind of why we're excited to be doing what we're doing with in the COVID epidemic ourselves.
So tell me a little bit about this big win for Cohealo and this ventilator sharing program.
Well, I think as everybody knows, COVID-19 has led to a bunch of supply chain issues in healthcare. The ones that are gathering the most headlines is the lack of personal protective gear for the actual doctors and nurses themselves. I think the secondary issue is that there's some medication shortages. But it became clear to us about 4 to 5 weeks ago that COVID causes respiratory failure, and if there was a significant number of patients succumbing to the illness, that there would basically not be enough ventilators to run to keep everybody going in ICUs throughout the country. So we saw this idea of they can open up field hospitals, but there wasn't enough equipment, capital equipment. So we took a look at that. We've been moving medical equipment for 5 years now. We're the best at it. We're the first and only really sharing economy company in healthcare. And we looked at this and we realized actually structurally our platform was purpose built for doing what we thought needed to be done, which was people should be sharing equipment. We didn't want to be one of those companies that just capitalized on COVID. There's an enormous number of companies that are laying some indirect claim that they can help. So we took everybody, and despite the fact that we were all working from home, we dug in and created, what we think is, it's not even an MVP. It's actually a very good product for identifying and tracking ventilators at a national scale, and basically being able to provide data to the government or whoever wants to control the flow of ventilators from suppliers into the health system, or to share ventilators between health systems that it may not need them. Andrew Cuomo, very early on, like 3 or 4 weeks ago, realized that New York was going to face a drastic ventilator shortage. He said, "I need 30,000, and I need you to send them to me, and I need to borrow them, but I will give them back." And what he realized and what emerged, and now what now conventional wisdom, is that the peak of the COVID epidemic is not evenly distributed amongst the states. And it's not even evenly distributed within counties, within states. So the opportunity to share equipment, move it around to maximize the supply that exists at any given time was just a no-brainer to us. This is what we do for a living. And
Yeah, what the company was founded on.
yeah, that's exactly right. I mean, our day job is mostly moving really, really expensive surgical equipment around so that our clients can reduce their capital equipment requirements by up to 50%. But what's really at work here is this idea that we built a platform hosted in the cloud. It's all AWS, Ruby on Rails, and new technology. And the fact is we can work the entire United States. We basically looked at this and said, there's only 5,000 hospitals in the United States. They're basically owned by about 200 or 300 entities in their entirety. There's only about 150,000 ventilators in the United States. So this is not even a chip shot in terms of what the platform can handle.
So, it's obviously across our portfolio, we see all of our companies trying to figure out how to, what to make of this crisis, both endogenously and exogenously, thinking about what to do in terms of burn and, hiring or not, and customers. So walk me through sort of the human part of this as a company. How did you go from, hey, we've got a crisis in our company, in our market, to let's find this incredibly big opportunity to help the country out and do our business at the same time?
Well, so frankly, Krishna, I think that you were part of that. I think that you were probably one of the only investors in the community who sort of decided that rather be scared, this was the time to be bold. There's certainly dry powder out there, but there just doesn't seem to be a taste during these types of panics to kind of go for it. The interesting thing I think that is shaping up is that there's enormous opportunities for some companies across all industries, and then there's some terrible losers. I think everybody already knows who those are now, and I think the question is, which side do you want to be on? And if you can demonstrably pivot to come up with a solution that's credible. I'm a product guy, but so I need a credible solution. You can't go to market with vapor. Then you just do it. And so the team, to be very honest, everybody was working from home because we did close the office pretty early. There's almost this it's almost like just laying in a bed. You're not using your muscles. So this was a sensational opportunity for us to really push and go for it. As a leader, you got to push through some of the guys going, what do you mean? We're really going to do this? We're going to try to get, how are you going to close a deal with the whole United States? And I'm like, I don't know, we'll figure it out, but let's build something. Let's do stuff. Let's build. So there's definitely a rallying cry, but to be very honest with you, it came from your blog post. I mean, the recognition that there's, going to be winners and losers in here. And there's no sense of sitting on dry powder if there's an opportunity. And that's, whether it's your investment dollars or if you're a company, it's sitting on your people worrying about what you're going to do, tomorrow. So I think, there's a practicality to it, but by now where we are, I think as an investment community and as companies of investors, we know who the winners and losers are going to be. I mean, the COVID it's going to go away. And if you haven't gotten to that point by now, it's not going to happen. I like education software. My kids' teachers are looking obsolete with every WebEx, right? Because they're learning more from the programs that don't involve teachers than the ones that don't. And in healthcare, the winners are people who, stretch the dollar. The winner is the groups that are virtual, right? I'm hugely excited for patient monitoring, remote patient monitoring, telehealth. The telehealth industry is jumping up and down. Finally, the Luddites get it, but it took a crisis to get there. And on the other side, if you're, making other systems, if you're, if you're not touching it, you're not going to touch it, and it's probably too late.
And I know you mentioned you're a product guy and you have to have some real product shift. And so walk me through what are the similarities and differences in what you're doing with the US government here with the ventilator program compared to your core business, and how did you guys from a product perspective shift a little bit to get there?
Yeah, so everything looks easier than it really is when you talk about it. And if to understand to understand what the government is proposed. And let's go backwards one more step, right? There's been a number of announced public-private partnerships that have gotten everybody excited, but quite frankly, haven't really panned out.
Yep.
Right. So when I looked at this I said, this is again, a reason why we need a credible product. We need to be actually very helpful here. We need to be scalable and we need to go now. What I think about when I think about this, we built a system that basically over the years has tackled all the vagaries of what it means to take a piece of equipment that's incredibly, sensitive, delicate, needs to be sterilized, needs to have, certain things about it, has all sorts of accessories, attachments, all sorts of complexities, and move that piece from point A to point B. And we've been doing that. And over the last few years of the company, we've moved, well over 5,000 or 6,000 pieces of equipment, multiple types of equipment. And, we've actually essentially handled just about every type of medical equipment there is. And, having that in the box means when you go ahead and now all we have to do is do one equipment type, a ventilator. Yep. That's easy for us. But for we were talking with some of the major health systems in advance of the government's announcement. And these guys would all say, I think I have this. And then they were calling back a week later going, it turns out this is more complicated than I thought it was. So there's, an interesting opportunity that comes from being first and the best at something and having that experience. The second component, I guess is a little boasting on my part is I think, there's a little bit of seeing around corners early and knowing what exactly is the workflow that you're going to propose to these people. How do you keep it simple? There's the whole, blitz scaling feeling of knowing like every time you basically put a human in there or you leave an extra step in there that's not necessary, you're basically committing yourself to death. And, what we look to do is obviously have the platform take on as much work as we possibly can. And then, basically, without getting too deep into it, it's not actually anything of the clients either. So our first approach to this is getting, grabbing the inventory of ventilators in the country across all those health systems. And for us, again, it's not a hard job. And it's something that scales really well. We have the ability to script and automate a lot of the processes of getting this going very, very quickly. Now, the American Hospital Association is essentially our boss here, or our buyer. They're the ones who are convening all these hospitals, and they have detailed lists of every hospital in America, including contact information and stuff. So we just had a call with them, and they're basically going to give us our data on a platter. And I think we'll be, live in literally a matter of days. I think there's political issues and other things in the background there that may slow us down. But from a technology perspective, we're ready to go.
Amazing. Wow. So that's huge. What do you think about if you think ahead for 1 second, how do you think about the logistical issues and logistical challenges of moving equipment around the country versus more locally? I mean, is it going to be still very regionalized? How do you think about, especially during a pandemic, the logistical challenges that might, to your point about seeing around corners, can you foresee some challenges, and how are you guys planning for that?
Well, I think there's a couple of things. In the consumer space of sharing economy, there's this whole concept of trust, and it's really important. And for us, what trust means is, if a hospital is going to, loan a couple of pieces to a national pool, which is what this proposal really is, they need to know they're going to get it back and it's not going to be broken, right? Sure. They're actually all hoping for a great cash for clunkers ventilators deal at the end of the day, because the government should buy all this stuff back up and actually create a real store for it, right? So we see an opportunity on both sides of this. One is creating the sort of trust, non-repudiation, and an ability to basically track this stuff and keep good care of it. It's a track record that we have. And at the same time, I'm already looking ahead to, I doubt that we're going to want to reopen the economy. And this is the whole reason why Jared Kushner, sort of called on everybody. Nobody wants to reopen the economy unless we're ready to handle another spike.
Yep.
And this is where I think, everybody's, nobody really wants to be a borrower. Everybody wants to be a lender. I think that's a Shakespeare or a Ben Franklin thing in some way, shape, or form. Never a borrower, but a lender be. Right. And I think at the end of the day, this is, a combination of knowing that your equipment is in good hands, knowing that we actually can give a loaner visibility into the piece of equipment no matter where it goes. It could end up on a West Coast tour from Cincinnati. We don't know how it's going to happen. The best solutions here to sharing equipment, and this is geeky, sorry, but the best solutions to sharing equipment actually are giving people the make models that they're familiar with, that their teams use. It's not necessarily bringing them the latest and greatest jet, fuel, rocket ventilator and sticking it in there. And this guy's going to scratch his head and say, this doesn't look anything like the one I know how to use. And he's going to spend 2 hours with the instruction book and still get it wrong. There's also sort of bizarre stuff like the disposable stuff, the tubes, all of the fittings and stuff have some differences. So you could be sending a ventilator to a group and they can't even use it because they don't have the disposable equipment that they need to use. There's a bunch of other things like that. So we feel that we're basically going to be able to get this stuff mobilized, without hassle. And I think that that's going to keep people engaged in the program. And then I think there's, for us as a company, how do we add more value into that base? And then is there an opportunity to really offer up a permanent solution to a virtual depot of equipment, as opposed to the government having to stockpile, 5X of everything, right? And so I think there's actually an IT solution there. It's not so much sharing as it is awareness and visibility.
Tracking, yeah.
But it's a real solution.
Yep. So how do you think the industry, the healthcare industry, changes because of this pandemic?
So, a couple of things, and some of this is related to some not.
Our customer base with the hospital.
I'm sorry, I'm sorry, repeat the question, Kristen.
I said, I was asking how healthcare changes with the pandemic, but actually I wanted to narrow that specifically to hospitals and sort of the health system that we serve. How do you think their businesses change? For example, I was hearing that people are expecting that there'll be fewer procedures done in the OR until we find a vaccine, because they're going to have to clean the thing between every procedure. And so I imagine that kind of behavior will actually be beneficial to you, because your procedures means there's going to be less willingness to buy equipment, more and more sort of awareness and willingness to share.
Yeah, that's exactly right. I mean, these health systems, like any other company in America, have been overly leveraged, and the EBITDA margin on most of the hospitals in America is negative, right? So they're now without, and elective surgery is the most profitable portion of their P&L. So what we're really seeing right now is this, incredible flipping of the EBITDA across, even like Cleveland Clinic makes all its money from the, high volume surgery, elective surgery. And so this is I hate to say it, but this is actually quite the value proposition of what we do, which is as these guys try to dig out, and by the way, digging out without any, they're going to be cash poor, to say the least, right? The only way to dig out and get all your elective surgery done is to maximize the utilization of the equipment you have. So, again, this is one of those ones where I always get, we're capitalizing a little on a thing, but I think we're really helping. I just think the recovery for U.S. hospitals moves faster if they're partnering with us. And so we're feeling pretty good about the sort of next stage go-to-market. Again, just being as conscientious capitalists that we are.
Yep. And how about, you mentioned a little bit about this earlier around, telehealth, or so from a tech, if you're an entrepreneur today and you want to tackle healthcare, where would you be?
Well, telehealth and virtual care is crowded, but it's not finished yet. It's still in flux, and I think we're still learning
a portion of the industry that can go telehealth, right? Because there's still, I mean, you mentioned remote patient monitoring support, but also diagnostics for a lot of stuff still needs to be done in person. And, unless
Well, if you think about it, the whole system, the whole healthcare system used to be based upon the visit. You went to your doctor, right? And they talked to you for 15 minutes, and then that was supposed to count for whole 365 days a year, right? Yeah. That's just ridiculous, right? That's not the way any other business does their contact management anymore. It's just healthcare, right? So now we're throwing on this idea. Now everybody's realizing that the visit isn't even essential. The whole swath of thing. So virtual does become a thing. The next thing we're realizing is by trying to it's ludicrous to line people up in a parking lot so that you can do testing. The testing should be over the counter. And it should be tied to a barcode that you can put in your phone and to do the contact testing. This is not a healthcare solution, it's a consumer solution.
Right.
I think, the big slide here, maybe unfortunately for the hospitals in America, is the challenges is there's been all of these sort of substitutes nipping at their heels, like Walgreens, Boots Alliance and CVS. Those are obvious ones, Amazon there and others. But I think what we're going to see is a slight dismantling of we can't constrain healthcare. We can't pass all humans through the hospital or through the medical office and expect to touch them all. We need the parallel process. And so the next stage of all this testing in order to reopen the economy, I mean, that's going to be a bold, ambitious project to get tests out to consumers in such mass quantities that there's no way the healthcare system itself can be responsible for it. State labs, you know what I mean? State labs, you can't do it. It's got to have to be, the laboratory test manufacturers and consumer companies getting this stuff out.
Interesting. Well, look, Todd, last question. What advice would you have other entrepreneurs today as they are thinking about, this crisis, and how do you find opportunity in crisis? You touched on it earlier, but if they're all trying to find their big, hairy, audacious goal, advice for them?
Yeah, well, a couple of things. I mean, I think for entrepreneurs that are sort of looking at healthcare, there used to be a ton of trepidation. It's a regulated industry and it's got some vagaries to it, which I think the healthcare people will all tell you about. Notoriously long sales cycle, et cetera, et cetera. But I think that the opportunity is greater to get into healthcare than ever before, because I see all of this sort of regulation dropping. I think the barrier to entry has been a little bit of a fake out for folks. And I think the healthcare is, essentially 10 to 20 years behind in everything it does compared to other parts of the economy, fintech, ad tech, that type of stuff. So I think the way I think about it is if you've got a great idea or you've got a great technology, don't write off healthcare right now, especially since it's changing so rapidly and dynamically that I think there's definitely stuff to hitch on to, and I would not be hesitant at all. I would look at every one of these through a lens of whether there's an opportunity there. And I think for your colleagues in your competitors and your colleagues in venture, I think it's always time to look. I think it's time to look back at healthcare again. Because I think there's going to be a dramatic sea change of the consumerism and virtual and some of these other things. And the healthcare vendors of the day, I mean, I spent 12 or 15 years doing electronic health record. They're still not anywhere near as cool as consumer electronics or consumer software. And they're not as good as most B2B and most other segments. So if you've got a great tech team, and you've got good user experience folks, and you've got a good, eye on a platform, you're going to build it to work the whole world right out of the box. And you might just end up being the new Epic.
Awesome. Thanks so much, Todd. Congrats on the big win, and onward and upward.
Thanks a lot. I'll talk to you soon.
Take care. Bye-bye.
Bye-bye.